I think for patients who are considering knee replacement, you want to have knee pain as your primary complaint. So if you come into the office and your knee hurts, and we have tried other treatments for you, injections, medications, physical therapy, avoidance of the activity, those things are unhelpful to you. You have an x-ray that shows arthritis, and it's substantial, meaning it's not occasional discomfort, it's regular discomfort. You're miserable, you're near miserable. That's the person who I think should consider knee replacement surgery. There are two separate kinds of knee replacement. There's total knee replacement and partial knee replacement. In partial knee replacement, one side, either the inner side or the outer side of the knee, is replaced. That's for younger patients with one small area of disease. So we've developed a rapid recovery program at Riverside Walter Reed, which allows you to have the procedure done in the morning and be up walking a couple hours later. And I think that's very beneficial to our patient population. That has allowed patients to progress faster in their recovery, go from maybe a walker in the beginning to a 4-poster cane to nothing within 2 to 4 weeks. After that, it's home health for a week or two, and then physical therapy outpatient as soon as we can get you there. The best recovery is a patient who is independently motivated, limited pain in the knee after the replacement, and in physical therapy.